Good evening and welcome to the Citizen Oversight Board Quarterly Public Forum. We are excited to come to you today with guest Sheriff Elias Diggins, as well as a number of community members who will provide some comments on their experiences with our Denver Sheriff's Department. I'm going to start us off with a couple of announcements and logistics. So first off, we are live with the posting for the Independent Monitor. So that recruitment is open. If you know folks or you are folks who are qualified for that position, we encourage you to apply. The position will be posted likely through August, and then we'll begin a process similar to what we did the last round of recruiting with screening committee interviews, Citizen Oversight Board interviews, and public engagement. So excited about that. We're thrilled to have that posted and ready for the next Independent Monitor to join the city. The Citizen Oversight Board itself has 3 vacancies at the moment, and we are eager for folks to join us in our work. We've had a number of longtime board members recently roll off, and we'd love to have interested community members join the board. It's a really neat way to give back to our community, and certainly there's no shortage of work to do in the public safety oversight space. So eager to have you there. We can provide the link in chat, but the website is denvergov.org/COB, and all of the application information is there. So with that, I will turn it over to few logistics. So we are eager to have community member participation, should you be interested in that, and can take your questions via the Q&A section of this Zoom meeting. And participants can thumbs up or thumbs down questions, and so that helps us prioritize the questions that the largest number of attendees wants to hear. So, feel free to put your questions into the chat, and then we'll work through those. Okay, any other logistics, Daniel, that I need to cover?
If for anyone who is watching on channel 8, you can email cob@denvergov.org, as you do not have access to the chat in Zoom, but that account will be monitored. So you can send in comments or questions to cob@denvergov.org.
Great, thank you. Very helpful. Okay, so Sheriff, welcome. We're happy to see you. It's been a while, and it's been a busy summer. So we sent some questions to you in advance, and you're welcome to work through those along with any kind of introductory comments or statements you'd like to make, and we'll go from there.
Thank you, Madam Chair, and good evening to all of the folks that are watching tonight. The Denver Sheriff's Department continues to serve proudly the citizens of the city and county of Denver. The hardworking men and women of this organization are dedicated public servants who pride themselves in service to the community. I'll begin to work through the questions one by one, and we'll pause for any additional follow-ups to each. The first question has to do with the grievance incident response team investigations of deputy misconduct. It reads, per page 8 of the recently implemented operational policies for the Public Integrity Division's Administrative Investigations Unit, otherwise known as the AIU. The AIU is able to send certain complaints of deputy conduct to the DSD's grievance and incident Review Team, otherwise known as GIRT, to investigate. The question is, are there any specific processes or policies in place for GIRT personnel to follow when investigating allegations of deputy misconduct sent from AIU? The answer to that is yes, there are. In fact, our GIRT unit has very extensive policies and procedures, which were developed by our department in coordination and collaboration with the Department of Safety and the Office of the Independent Monitor. When the GIRT personnel, who are primarily sergeants and a captain, along with civilian personnel, receive those complaints, they do look into them. They first begin by reading through the complaint to determine what information should be gathered. From there, they may begin to interview the subject or the person who's actually complaining about the issue, as well as speaking to witnesses that may have been around or identified when the incident may have occurred. They also may review video evidence and other means of gathering information related to the matter, and then begin to make a determination about what the finding for the case should be. As they make that determination, they track that information in a log that is reviewed internally, but also has access by the Office of the Independent Monitor. All of the folks that work in our GIRT unit are seasoned veterans who work side by side with our Public Integrity Division, Administrative Investigations Unit, and also work very closely with the Office of the Independent Monitor. They're overseen by the Chief of the Administration Division, Sonia Gillespie, and we're very proud of the fact that we stood up the GIRT team a number of years ago after the reform efforts in the Denver Sheriff's Department, and believe that their practices are sound.
Great. You can kind of move through, I think, the questions, and then we'll field community questions at the end, if that makes sense.
Okay, sounds good. The next topic is the city auditor's report on mental health services. The first question is, in the DSD's response to the city auditor's recommendation 1.3, the DSD says that Dr. Johnson has developed a mental health roadmap to include the vision of the Mental Health Services Division and an outline of the process for each individual who books into the downtown detention center. Is this roadmap available for the board or the public to review? Is there anything that you would like to highlight in it? The draft of that is available for the board to review. It's not ready for public distribution, but we would be happy to share the draft with the board. I do have it in front of me and can tell you there are 4 areas that Dr. Johnson, who is our Chief of Mental Health Services, has identified in this mental health roadmap to help us to ensure that we're providing the best services from the time that someone comes through our door into custody until the time they leave out of our custody. The first is an interview session where an assessment is taken for all individuals that enter our facilities. The second is a course of action, a post-assessment evaluation. Third is potential intervention, such as the crisis response team supporting the individual and as well as our deputies in any crisis response involving serious mental illness, along with the work that we do with our partners at Denver Health and Hospital Authority, who provide medical and mental health care to the people in our custody. And last is potential treatments, such as individual therapy, going to a treatment unit, case management, transition planning, medicated assisted treatment services, group therapy, and medication intervention. Over the past couple of years, Dr. Johnson and her team have done a phenomenal job of setting the vision for where we're going and transforming the work that we're doing related to mental health. And hopefully we get people stabilized while they're in our custody, but also return them back to the community better than how they came in as well.
Can you say a little bit more about that roadmap, I know you've rolled out, MAT as a protocol and other things. So you're drafting the roadmap, but you're also sort of implementing parts and pieces of it, sounds like, or, talk a little bit about what that will look like when it's complete.
Yeah, as we begin to look at how do we ensure the best services for folks from the time that they enter our custody until the time they leave, the first thing that we want to do is in our intake area, provide a quality evaluation, not just for their medical care, but also their mental health care. So as soon as they arrive, we can begin to map out which program may be best for them, whether it's related to an addiction issue, whether it's related to a mental health issue. Sometimes folks have less severe mental health conditions that don't require treatment and might just require medication. So from the time that they arrive, we want to begin to assess which place in our custody best suits that person for their well-being and their stay with us as well. What that roadmap is going to do is kind of give guidance to our staff about what that means for each individual as they work through those processes. And it also provides a visual representation to people that are perhaps in our custody or the community about the good work that's being done by the Denver Sheriff's Department, along with our partners at Denver Health as well.
Thanks.
I'll move on to the next question. The auditor's report recommends utilizing an electronic health record system and says that while there were plans to do so, there was no timeline for implementing such a system. The DSD's response to recommendation 2.11 indicates a planned implementation date of January 13th, 2023. Where is the department in this process, and when might Denver Health have a working EHR system? Denver Health technically already has a working EHR system on the Denver Health side. So at Denver Health, they work an electronic health record system titled Epic. What we have in the Denver Sheriff's Department with the Denver Sheriff Health Services team is a paper system where we're still doing charts and every other medical recording by paper. We're looking to transition to an electronic health record to provide a better continuum of care so that when someone comes in, perhaps we already know who they are through their health records from Denver Health or another connecting system. And when they leave our care, they can have a continuity of medical services that perhaps can continue into Denver Health as well. We are currently in the process of working through that with Denver Health at the table, with the Sheriff's Department at the table, with the Department of Safety at the table, and Technology Services for the City and County of Denver at the table. And our teams have been meeting, in fact, weekly, as we begin to present to a group that's known as the iFund for Technology Services for the City and County of Denver. They actually give the green light to move forward with funding projects related to electronic means inside of the city. And we've gone past step one to be able to meet with that group. And now what we're doing is working through the scope of work and the technical requirements related to the electronic health record. And we look forward to hopefully getting that stood up as soon as possible, possibly by launching a request for proposal early in the beginning of the year. But again, those conversations are still happening. In fact, the group met earlier today. I wasn't able to join them in that meeting, but I have been involved in previous meetings. We do have Chief Sonia Gillespie, who's the Chief of Administration, as well as Dr. Nikki Johnson, our Chief of Mental Health Services, along with our internal technology team, who's working through helping to develop that scope of work, along with Denver Health and those other folks that I mentioned as well.
Okay, that's helpful context. Thank you. So can the community understand that the project is funded? There is funding identified and allocated in the city for this, or not yet?
We have to make a request for the funding.
Okay, so first scope, then request for funding.
That's
Okay.
exactly it. Because we have to know exactly what we're asking for before we ask for the dollars.
Okay, great. So really at the very beginning of the work and doing collaboration to get started.
Correct. And I would say we're at step two. Step one is being accepted as one of the projects that's going to move forward for a presentation to the I-Fund, and we've been given the green light for that. Now it's the developing the scope of work and the technical requirements to figure out about how much money it's going to cost for us to do this project.
Okay. Never a small amount, that's for sure, with those kinds of systems. So great. And then, just a side question in terms of scope, and maybe you're not there yet, but would the intention to be to make electronic all the existing paper records, or would the intention to be add into the system anyone that's a new inmate or a new medical case? I'm just interested in, is the uplift from paper records into the system, or would it be sort of net new as folks enter the system?
It's likely to be a hybrid. As you can imagine, we have thousands of records that would have to be entered. Of course, what we want to do is ensure that there's a continuity of care for the folks that are already in our custody.
Mm-hmm.
We also have records for folks that are not currently in our custody as well. So we want to ensure that we have accurate records for everybody that's here now and going forward. And so we'll be working through the process of exactly what that looks like with the recommendation of Denver Health and other subject matter experts.
Okay, thanks.
Okay, I'll move on to the next section. And it's a good segue to talk about Denver Health. Has the Denver Sheriff's Department made any changes to next year's contract with Denver Health? The answer to that is yes. Those contract negotiations are still underway. So I'm not at liberty to discuss what we've been talking through, but there are changes that we are proposing to our contract with Denver Health. Next, has Denver Health completed their investigation into Leroy Taylor's in custody death? If so, have you seen that report? It is my understanding that they have completed their side of the investigation. I have not seen the report. I have, along with the city attorneys, made a request to receive a copy of that report, but have not received it.
Thanks. We'll also be requesting a copy of that report, no doubt. Do you have a sense of, sort of when you might see that and the next steps coming out of that?
I'm not sure, as you are aware, and as I'm sure the community is aware of, these are very complicated matters, and the timing of them sometimes happens very soon. Sometimes it takes a little while, so I couldn't give a timeline currently for it.
Okay, thank you. And then is there anything you can say about disciplinary actions related to that incident that you may have taken internally? Last I recall, the officers involved were on administrative leave, or I can't quite remember. So can you just say a little bit about how you're managing that internally?
We didn't have any of the Denver Sheriff employees who were on administrative leave.
Oh, okay.
Are related to that matter.
Okay. All right.
Next is program updates, providing inmates with personal tablets. The Securus tablets, Securus is the inmate phone system provider for the Denver Sheriff's Department and is the group that's responsible for those tablets. We worked with them and went through the council process to get those tablets approved, and that went through, I believe, on July 18th with City Council, and following that went to the different offices for signature, the mayor's office, the auditor's office, and such. And so we now are beginning the implementation of programming for that, and Securus tells us that it generally takes about 90 days from the finish of all the signatures to the time that those will be implemented. So we have a project team that's being led by Chief Vince Line in operations, as well as Major Kelly Bruning, who are working to get that implemented. So we'll be happy to report out when they actually arrive, but it should be very soon. Next, are there any metrics available related to the medicated assisted treatment housing pod and associated programming? There are. And I will talk about that here as I read through this report. So our male MAT unit, MAT is short for medicated assisted treatment, is capable of housing 64 males. The unit provides medications such as Suboxone, Methadone, buprenorphine, Vivitrol, and to date, we have had 603 individuals in our custody that have been on MAT medications. That unit was opened on May 9th, 2022, so just this year. We've also been working through the Jail to Community team, which is under a grant with the Denver Health and Hospital Authority to provide those medications to those folks to ensure there's a continuity of services. And so as of August 16th, I can tell you the number of individuals served who have been administered buprenorphine has been 59, methadone has been 117, naltrexone has been 72, Suboxone 348, Vivitrol 7. So we're very happy about the great start that we've had to the MAT units. We know that as folks come into our custody and they're going through withdrawal, having this approach is going to help people to become stabilized while they're in our custody, but also hopefully get them connected to services when they're back into the community and they can continue on those medications as well. Our female MAT unit is starting on September 12th. We already have some women who are taking those medications, but we're coalescing and putting them all in one unit out at the Denver County Jail effective September 12th. So our staff is working towards that as we speak. Okay. The next question is, are any metrics available regarding the issuance of harm reduction release kits? And I have that information as well. As of August 13th, and we started this project on April 18th, we have given approximately 804 harm reduction release bags to folks. And for the community who may not be aware of what those are, in those bags, we have a dose of Narcan, we have 5 fentanyl test strips, and inpatient and outpatient medicated assisted treatment resources in the Denver area, and a contact number for Narcan replacement. So that when folks leave our custody, we're arming them to help folks that may be suffering from an overdose or perhaps may have a need to test their fentanyl. And we believe that this is helping people as they come back into the community with the realization that this is something that we're all dealing with, and saving lives is what we are trying to do. So we're very happy that this program has been very productive and that those 804 bags went out to the community with folks when they left our custody.
Do you have a way of measuring the effectiveness of that program?
I think the metrics regarding the number of Narcan doses that we're giving is our measure of success. I think the more Narcan that we can send into the community, the better that it's going to be. We hope to up that number in the coming months. We know that there's some legislation that's going to require for folks to perhaps have 2 doses of Narcan. We're looking to target that as well. So we believe those are the measures of success. If we can ensure that every person who's being released that has a need gets one as they walk out the door, for us, we know that that's going to save lives.
Thanks. One more question, because I know it was something that came up on, and then I'll turn it over to other board members and open it up to the community for additional questions. I know we had talked probably 8-9 months ago at this point about the rollout of body-worn cameras in your facility. So can you talk a little bit about that and give us an update on sort of where that program is?
Absolutely. We're almost completely rolled out at the downtown detention center. The last data that I received from our team was we were above 90% of our staff at the downtown detention center had body cameras. The next phase for us is to begin to do a rollout at the county jail in the next batch, which will be distributed in January. We also have body cameras on our court services staff, on our civil division staff. So we continue to move forward with ensuring that at the end of this project, every person who's in uniform will have a body camera. And I wish I had a picture of the bay that we have at the downtown detention center. It's a sight to see with all of those cameras in there. We had to actually repurpose a room because we have so many body cameras. There are 5 layers of body cameras, probably 15 feet across, with a body camera in each one. And our staff has been very diligent about making sure that they're wearing those and they've gotten used to them. And we know how effective they are in demonstrating what's going on inside of our facilities.
Thank you. Questions from board members?
I have a question.
Hello, Karen.
Hi, how are you?
Good. How are you?
I'm well, thank you. You know, I've gotten a certain amount of curiosity as a result of watching footage from the cameras, and my sense is that they're traditionally placed like in the middle of an officer's chest. Is that the general placement?
Yeah, that's generally where body camera manufacturers recommend to place them. That way, the field of view captures the person who the other or who the officer may be talking to, as well as their surroundings as well.
What I've noticed is that oftentimes, like when aim is being taken with a gun, or there's a hand-to-hand combat between the officer and a citizen, that the camera kind of like falls away or gets blocked in terms of its scope of vision. Is there any thought process around relocating the camera so that it is able to capture more of what's going on in the event of hand-to-hand combat or when an officer raises his gun?
I think the current manufacturers will all agree that with the current technology that they have, that's the best placement. I'm sure as we move forward and technology changes, perhaps there might be someplace else that those cameras could go. But with the way that the cameras are set today, not sure there's anything different that could be done. One of the advantages that you have is multiple officers having a camera on gives you a different view from different angles as well. I think that's probably something that's an advantage for us. You know, a lot of our work is done in facilities. So not only do you have the angle of the body cam, but you also have those views from above, perhaps in the courthouse. I think currently what we have is some technology limitations, but again, this is fast moving technology and hopefully manufacturers will be able to resolve some of those issues in the very near future.
Other board questions? Go ahead.
Oh, Al, I can see you, but I can't hear you.
All right, how about now?
I can hear you now.
Okay, quick question for you. Thank you. This is in regards to the current discipline matrix. I'm not sure contains information or information regarding body worn cameras, because the body worn camera portion is pretty new. Has that been incorporated into the new discipline matrix as it pertains to officers that are not wearing their body worn camera, and consequences if those body worn cameras are not worn? And it's kind of based on, you know, during the protests and what have you, there was a lot of information, but footage we didn't capture because those body worn cameras weren't there. So has that been updated to accompany and to fit this new mandate? Thank you.
Yes, sir, it has. The body worn camera requirements for all uniform staff who have been issued them is included in the disciplinary matrix.
Just another question. I know we have, sort of an ongoing dialogue about your staffing levels and recruiting efforts, and just wondered if, you could give us an update on sort of where you are in terms of, being fully staffed and the recruiting efforts we've talked about in the past.
Sure. And let me first start by saying we would love for members of the community who are watching, or perhaps they know someone who wants to serve in a great department, to serve the Denver community, to come and join us. This is not a job, it's a career, it's a call. So let me start with that. Our staffing levels have been challenging, as they have been for a number of years, along with a lot of law enforcement agencies, most law enforcement agencies across the nation. What we currently have is a 4-part strategy to address our current staffing challenges. The first thing that we're doing, because we have a lot of vacancies in our organization, we have to make sure that those posts are filled. They cannot go unfilled. So very recently, I issued an order where we now have pre-scheduled overtime for deputies that are on provisional assignments. Those are the folks that are working in court services, that are working in civil, that are working at the training academy, places that are not in either of the jails or at the correctional care medical facility. Additionally, all deputy sheriffs are required to work 6 hours of overtime per week at a minimum. And that's going to help our staffing to be sound when it comes to the operation of our facilities. The second thing is we're looking at proactive retention strategies, such as increasing the pay for deputies, and we're working through that process now. Morale boosters to hopefully lift the spirits of the people that we want to stay here, the good folks that we want to stay here. And we also are doing things like changing the mandatory mask policy. Our staff had been in masks since the beginning of the pandemic. A deputy sheriff that worked in the jail had to show up and wear a mask 10 hours, sometimes 16 hours a day. That became very daunting. So we worked with the Denver Department of Public Health and Environment. They worked with the state of Colorado, and lifting that mask, mandatory mask wearing for our staff is now voluntary, has been a huge morale booster. The third thing that we're doing is we're allowing sergeants to work voluntary overtime to fill some of the slots. The sergeants are the frontline supervisors for the deputies. And some of them came to us and said, hey, Sheriff, hey, Chief, I want to help out. I want to stand next to our deputies and show them that we're right there with them as they're going through this. And we want to volunteer for overtime. So we're now allowing that. And we're also looking at recruitment as well. So we're looking at a reduction of steps for onboarding new deputy sheriff recruits, and also creating a shortened lateral academy. What that means is when folks come into our agency, they have to go through a 16-week academy. Well, we have people that are working in other sheriff's departments who may want to consider coming to the Denver Sheriff's Department and don't need to go through an entire 16-week academy. We're looking at a shortened lateral academy, and hopefully that will be attractive to folks that want to come on to the DSD. So we have a 4-part strategy that we've launched. We're working side by side with the Department of Safety, the mayor's office, other folks. We have city council support, a lot of support, and hopefully folks see that the Denver Sheriff's Department is doing good work. We appreciate all of the community support that we've gotten as well. It's a tough time, but we are not going to give up hope. We know that with the things that we're putting in place, as well as working with great organizations such as the Fraternal Order of Police and other employee groups in the Sheriff's Department, that we're going to have that trend line go in the other direction. Instead of going down with attrition levels, we're going to go up and bring people on board.
Thanks. Just a follow-up question on that. The city, I know, just completed its engagement survey of city staff. Was your organization included in that? And if so, anything you can say about the results? To your question about morale boosters, what are the facts saying about that?
We were included. The results were not surprising to us. I think it gives us a baseline to know that we have some room to grow, some room to go to get better, and to make sure that we're leaving no stone unturned when it comes to helping our staff not just have a good work environment, but for our supervisors and all of the leaders to be able to focus on that together. We're actually going to be meeting with the Office of Human Resources, with their leadership team, and begin to set a plan based on those survey results on things that we can do to get those numbers up.
Thank you. Other board member questions?
Question. Do you have actual numbers that reflect the staffing levels you have at this point?
Yes, today we have 459 deputies out of an authorized strength of deputies of 750. So we're down close to 300 deputies. And then we have the other ranks: sergeants, captains, majors, chiefs, and the sheriff. And we're almost at full staffing for all of those other ranks.
Thank you.
And again, I'll end this segment by saying we need good people. We do. We need good people from the community. Come put on this uniform. We have lots of vacancies, but that gives us an opportunity to bring on some great folks who want to make a career and serve citizens of the city and county of Denver.
Sheriff, in terms of incentives for folks to join the sheriff's department, whether that be signing bonuses, continuing education money, things of that nature, are there a number of, are those two things included? And do you have some more incentives that you have out there to entice people or give them incentive to join up?
Great question, Al. We do. We have a sign-on bonus for folks that want to come into our organization. They get $1,000 on the day they start the academy, $1,000 the day they graduate, and $1,000 on their first anniversary. And we have some other things that are in the works that I can't discuss right now, but additional incentives for folks who want to come on to the Denver Sheriff's Department. In addition, we're also working through retention strategies that have compensation tied to them as well, working with the folks in the city to look forward to hopefully putting those into place as well.
Thank you.
Okay, I am not seeing any community questions. Daniel, have we received any via email? Okay. Board members, final call for questions. And then we'll transition to some community comments.
I guess I have another one. And this is around, and it's more public information in regards to the general rank and file and some of the leadership in terms of confidence in leadership. In my mind, the first thing I go to is, do you have plans to, or have you gotten leadership together and any thoughts and ideas in terms to address some of those concerns and to heighten the morale, not morality, but the feeling of support to those rank and file, as well as some of the leadership in the department, because that is information that the community is aware of. So I would love to hear what your thoughts are and what your plan of action is to kind of make that more cohesive.
Yeah, we actually have been talking about that in our all supervisors meetings. And what we've been sharing is, bless you, Julia. What we've been sharing with all leaders is retention is not just the responsibility of the sheriff. It's the responsibility of every single leader in our organization. And it's been said that people don't leave good leaders, right? If you have a supervisor who believes in you, who supports you, who you feel like has your back, that goes far. when it comes to the way that you perceive your job. And we have great leaders in our organization who understand that, who absolutely want to ensure that we're keeping the great deputies and civilian and professional staff that we have in our organization. So it's something that we've been talking about for a number of months and working towards. We do have an entire group that's dedicated to retention strategies inside of our organization. They are dispatched from the administration division, and they're responsible for bringing forward some of those things, such as changing the culture related to the employee meals. Something as small as the way that the food service is done in our employee meal section is very important to our staff. Next week, we have food trucks coming for our staff where they'll have the ability to go outside, and I forget which kind of food truck it's going to be, but just morale boosters like that, just little things that make people know how much we appreciate them. In a couple of months, we'll have some more employee engagement things that are happening, but it's absolutely incumbent on all of the leaders in our organization that we focus on retention and ways to improve morale as well.
Thank you.
Question. Chief, you talked about the electronic health records, and just for clarity, does that apply to anyone's visit to a medical facility that is plugged into the kind of universal system throughout the city that maintains health records?
Right now, it would be connected to the electronic health record system for Denver Health because they are our medical provider. So regardless of where that person may go, so say someone has an outpatient service, like they're going to dialysis at DaVita, when they come back from there, the information that DaVita provides will be uploaded into the electronic health record system for us, which will then go over to the electronic health record system for Denver Health as well. So everything that has to do with medical care is done through Denver Health and will be uploaded by them in that system that we're going to bring on board.
Is that same system maintained for any psychiatric health issues that develop while someone is in your custody?
Yeah, it will be any record related to the care that Denver Health provides, whether that's medical care or mental health care as well, because they do provide both and work in tandem with our staff, our mental health staff under the direction of Dr. Nikki Johnson.
So would you have the ability to track the administration of medications while a person is in your custody, given through the different medical facilities?
Yes. Once the electronic health record is stood up, it will be able to track everything, their medicine, their treatments, their protocols, the requests that they made. I've seen systems like this in other jails across America. They're very, very robust. We're unfortunately behind the curve, but we're looking to catch up, which is why we're very happy to be able to move forward with an electronic health record system to provide the best care that we can.
And so would that enable you to continue the same kind of care in terms of beds and medical modalities are diagnosed and recommended in that facility? You would be able to do administer those things with the person in custody?
If we have a record that comes in, or let me say it a different way. If they are a patient of Denver Health before they come into our custody, and we know what medication they're on, as long as it's in what's called our formulary, then those meds can be prescribed to them. Otherwise, the prescribers will have to figure out what similar medication they can keep that person on, but they will have that record for that person's medicine and treatment, perhaps before they get here, can continue that treatment while they're in our custody, and then have a continuity of treatment once they leave our custody as well.
Okay. Impressive.
That's we're trying to do our best and provide the best care that we can.
Okay.
Good day, Mary. I see you are promoted into the panel here and your hand is raised if you'd like to provide more context or information on topics we've discussed. Mary, can you hear me?
I didn't mean to raise my hand. I'm sorry. I don't know how it raised. That was an error, Julie. Sorry.
No worries. We take hand raising very seriously. On these
Obviously.
meetings, so,
Goodness. Thank you.
Carries a lot of power.
I was hoping Mary wasn't going to throw me a curveball. I was ready.
I was hoping-
All right. Any more board questions for the sheriff?
Not from me.
All right. Well, with that, Daniel, I understand you've got an audio recording for us to listen to, and so let's begin there.
My name is Janet, and thank you for listening to me and allowing me to speak tonight. Sheriff Diggins, I brought my complaints to you in October of 2021. I knew from the look on your face and your words that you took my complaints seriously and informed me you would immediately start an investigation and would personally speak to me when this was completed. I did receive a letter with the results from AIU, the Administrative Investigation Unit, on June the 20th from OIM, Office of the Independent Monitor. This letter stated that my claim was declined for further action, yet this letter verified the complaints I made to you happened. AIU only investigated two elements of my complaints: the denial of clean clothing and the length of time it took for an inmate to receive his eyeglasses, 6 days. The primary complaint was the denial of an inmate's prescription medications and MET treatment. I'm still waiting to hear back from you on this. We are now 9 months on from my complaints and almost a year since the mistreatment of our loved one. Can you please give me an update on where this complaint is with Denver Health and yourself, and when I'm unlikely to hear back from you? If you're not able to speak directly to my complaints, then I hope you're willing to answer some general questions on the procedures and policies at Denver Detention Center for better transparency for us, the general public. The first thing I will talk about is how an inmate should receive eyeglasses. And I really would like you to talk about the policies and procedures so myself and other people, the general public, can understand this. I have a lot of questions, and I know you won't be able to answer all of them now or maybe never, but I'm hoping that you can tell by my frustration that the situation, all it's done is actually create more questions. And I really would love the opportunity to meet with you in person so that we could talk through these and discuss further and maybe talk about changes that are possible to make other inmates' lives a bit easier. So I'll start. Can you explain this procedure of how an inmate should receive eyeglasses and why it is necessary to have a lawyer drop off the eyeglasses, and what happens if an inmate does not have a lawyer? Can you please speak to the intake procedure an inmate receives with regards to their vision needs, and what action is taken by the intake nurse and that time frame? In particular, do they reach out to the inmate's previous prescribing optometrist? Is it mandatory for an inmate to receive an eye exam screening by the optometrist serving Denver Detention Center before eyeglasses can be dropped off to them? And why do they have to fill out a kite if the intake nurse already has this information? What training do your sheriffs receive on the dropping off of eyeglasses? And do you think that further training is necessary? I ask this due to the inconsistency from one sheriff informing drop-off lawyers that an inmate has to be seen by an optometrist first and denying the drop-off, to another sheriff just accepting the drop-off. Why and how are you going to address this? When and how are you going to address this? Can you please explain the procedure after the eyeglasses have been dropped off and the time frame for the inmate to finally receive them? For us on the outside, my assumption is everyone working at the Denver Detention Centre must understand the importance that an inmate can see. So why is this such a lengthy procedure causing unnecessary distress to an inmate? I'm going to have to touch on the clean clothes. Can you please state how many complete sets of outer garments and undergarments an inmate receives on intake? Can you please state the frequency of an inmate receiving complete sets of outer garments and undergarments and how and when this takes place? Can you please state during COVID, when inmates were locked up 23 hours a day or longer, how this laundry call worked? In your opinion, in today's society, under what circumstances would you find it acceptable to wear the same outer garments and undergarments for 7 days or longer, and why this would be acceptable for an inmate to have to do this? Can you explain the policy procedures you operate at the Denver Detention Centre that would make this a possibility, and is this really acceptable to you? What procedures, policies have been changed at the Denver Detention Centre to ensure this never happens to inmates from the perspective of personal hygiene and dehumanizing them? I also want to talk on the prescription medications. This was my primary concern and my primary complaint. Can you please detail the intake procedure for an inmate who takes prescription medications, in particular for mental health and addiction recovery? How does Denver Detention Centre handle inmates who are on MET? And what does Denver Detention Centre do to ensure there is no break in their medications so that they do not go into withdrawal? What percentage of inmates at Denver Detention Centre are on MET, and are you really equipped for that? Please explain the procedures and policies of how you handle this. How does Denver Detention Centre liaise with the inmates' previous prescribing doctors, therapists, etc., to ensure there's no break in their medications and their treatments? What mental health is available to inmates at Denver Detention Centre? What is the ratio of inmates with mental health, addiction recovery needs to mental health, addiction recovery, medical nurses and medical doctors on site? In your opinion, Sheriff Diggins, do you believe you are serving that community of inmates, their families and loved ones, with the essential medical care they need to continue in their recovery and wellness instead of destabilizing them? In your opinion, Sheriff Diggins, do you believe incarcerating that community of inmates at the Denver Detention Centre is the right thing to do, or if they would be better served in a recovery wellness environment? I know this is a difficult question, but I feel it's time for people to stand up for the right solutions. In general, do you think Denver Detention Centre policies, procedures need reformed? And if not, I would like to hear why not. If yes, can you detail and explain what you have done, what you plan to do, and the timeliness that you're, attending to these things? What is your recidivism rate for those incarcerated with mental health, addiction, and recovery health issues? Do you think long-term incarcerations are really helping these recidivism rates? In your opinion, what alternate solutions do you suggest would help those recidivism rates? And are you doing anything towards that? Thank you, Sheriff Diggins, for this opportunity to speak. I'm sorry if I sound frustrated, and I'm sorry if I have even more questions than I did before. I truly do feel that it would be nice to actually have a conversation with you, as you first mentioned when I made the complaints, so that we could talk about policies and procedures and what truly is possible for you to change easily or long term to make the life of the inmates better. Thank you to everyone for doing all that you do. I'm making a difference every day. Sheriff Diggins, thank you, and I hope to hear back from you.
So lots of questions there, Sheriff. If you would like to, what I heard was questions on eyeglasses policies, general intake policies and procedures, the policies around clean clothes and, when and how often, MAT and policies and procedures, particularly as it relates to individuals who are already under treatment elsewhere. And then your thoughts on alternatives to long-term incarceration and recidivism reduction. Did I miss anything in there, board members? Does that sound right?
First, let me start off by saying we certainly empathize with Mrs. Robertson and everything that she has gone through. It's not easy to have a family member that's in custody at any time. And we know that when people are in custody, their families are going through a very tough time. As many of you know, I speak from an empathetic lens on that, on the child of a person who was incarcerated many, many years ago. I can't speak directly to Mrs. Robertson or her particular situation. On March 22nd of this year, we were served with the legal hold as Ms. Robertson filed a claim against myself and the city and county of Denver related to this matter. So I'm unfortunately not able to speak directly to her or can't speak about this matter. I have responded to Mrs. Robertson's email very recently explaining that fact to her because she did send a follow-up email after receiving the letter from the AIU, the Administrative Investigations Unit, who looked into that matter. And so I did respond to her and let her know that I was not able to speak to her. But let me talk about the issues in a general sense that she raised. We do have a policy related to how folks receive eyeglasses. It's included in our policies and procedures. There's a couple of ways that this can happen. If a person wants to get glasses while they're in our custody and they don't have someone that can drop them off, they can submit a health services request form, what we refer to as a KITE, indicating the need for prescription eyeglasses. They will be seen by a doctor and perhaps even our optometrist if need be, and they will place them on the list to go and get an exam. If the inmate requires prescription lenses, the optometrist will supply the script, and upon receipt of those glasses, we will deliver those to the person in custody. The cost of that comes from the inmate welfare fund. We also have reading glasses for folks that have lower prescriptions that can be obtained from our program staff as well. If someone wants to drop glasses off, they can do that during normal business hours, 7 days a week. And we will accept one pair of glasses at the info desk. No type of case, soft or hard, will be accepted because we have to put them through a screening process to make sure that we're only getting the glasses. The watch commander will then go, or a designee, and ensure the glasses are scanned through security, and the watch commander or designee will ensure that the inmate signs for that property and places a receipt in their inmate or property form. The inmate will then be responsible for the possession and retention of their glasses while they're in our custody. So that is the process for how folks get their glasses, either by making a request to get an exam or if someone drops them off. In regards to our clothing procedures, each person in custody is given 2 uniforms. That is the standard issue for jails across America based on best practices, to have 2 shirts and 2 pants. For undergarments, when a person books in, we give men if they're indigent and they don't already have underwear, we'll give them 2 pair of underwear. For women, we'll give them 4 pair of underwear. And they can also purchase those items through our commissary as well. Laundry is done every single week. One of the things that we pride ourselves in is making sure that we're doing a good laundry exchange in all of those housing units. So every single week, those clothes are changed out. The people in custody also have the ability to sometimes wash their clothes. There are units where we have washers and dryers that folks can use. And we also allow them to purchase things on commissary, such as Tide detergent, if they want to wash their clothes more than the 1 week exchange that we do. But that is best practice across the nation. For the times that we were in COVID, we continue to not just have those practices, but also increased laundry practices and hygiene practices, good cleaning practices, because we wanted to stop the spread of COVID while it was in our facility, or it's still in our facility to a certain degree. But at the height of the pandemic, when we knew that hygiene was something that we had to focus on, it's absolutely been paramount for us to focus on those good hygienic practices, including making sure that we were doing laundry exchanges as we should have. She asked, Mrs. Robertson asked about recidivism. Our recidivism rate remains the same as it was prior to the.
Before you move on, can you just, with the clothes, can you say, so when you come in, you get 2 or 4 sets of undergarments and 2 sets of outer garments? And then how frequently, so they're laundered, but then that's once a week, just trying to understand. And then are you ever issued, like if you soil them or, there's blood on them or something, are they replaced or, how does that work?
They can be replaced. All a person has to do is let the deputy in their pod know they can be replaced, but they can wash them as many times as they believe is necessary as well in between those laundry exchange times. As you can imagine, we have over 1,700 people in custody. So doing laundry exchange is something that has to be methodical. It takes a lot of time to do that and to do it in a way that ensures that we're hitting every single housing unit to keep our facility as clean as possible.
Thanks. Okay.
Sure. I believe that our recidivism rate is similar to other jails. I think what we can do to continue to reduce our recidivism rate is the things that the Denver Sheriff's Department has been doing by increasing programs, by helping folks to get stabilized before they leave our custody with things like housing, jobs, educational opportunities. It's one of the reasons that we're bringing the tablets in, is to provide connections to the community so that folks can get on their feet before they leave and have those educational opportunities as well. Our program staff does a fantastic job. Over the past couple of years, it's been tough to do a lot of programming because of the restrictions that we've had throughout the pandemic, but we're looking forward to when we're able to open our doors again to have additional providers to come in and help the people that are in our custody to have those educational opportunities, those work opportunities, job opportunities when they leave, to improve our recidivism rate as well. And I'm not sure if I covered all the questions, the general questions that Mrs. Robertson had, but would love to ask the board if there were others that you thought I should answer.
Yeah, we have one more, which is just sort of the MAT procedures and how you transition somebody from, who's being provided MAT outside when they come in. And then one of our board members, Larry, asked, what if someone has a medical condition that will require more clothes? Can they be given more?
They absolutely can. And the medical staff will let us know that perhaps this person needs to have more clothes because of that condition. For those that have medicated assisted treatment needs before they get here, the first thing that we do is a verification. Most providers in the community are happy to let us know which medication that person is on. We hopefully can continue with that same medication. Our job is to make sure that we're doing everything we can to keep them stabilized while they're in our custody. And sometimes that happens with folks. If they come in, they're already on MAT treatment protocols. So we want to continue that. And as they go back into the community, we want to make sure that we're handing them off to those other providers to ensure continuity of care as well. Generally, that's Denver Health, but there may be other community providers that are giving them their MAT medications. As we talk about growing MAT in the community, we hope that at some point, it's not just Denver Health or very limited providers for MAT, that there are perhaps MAT treatment centers in places throughout the county. That's what we've seen in other cities. That's the best method, in our opinion, is for folks to be able to go and get MAT treatment where they live rather than having to come all the way downtown to get that treatment. So, but what we're doing today is trying to provide a warm handoff and also looking towards figuring out ways to get that connection for folks by hopefully getting them to those services as soon as they leave our buildings.
Okay, other follow-up board member questions? Okay. As we transition to our next speaker, Daniel, go ahead and promote. There's one more question I have, which is, so you screen everyone in intake and you sort of understand their medical conditions. And so somebody comes in, you know, with poor eyesight, and you know that because you've looked in their eyes, and they still need to make a kite request for that, or do you know, automatically give them glasses, or can you say a little bit more about that?
No, if they come in and we know that they're having trouble seeing, if they're obviously someone who is without their glasses, perhaps they lost them before they came in, Denver Health will work with that person to try to get them glasses as soon as possible. One thing that I have to say about Denver Health is the Denver Health, Denver Sheriff's services that they provide are fantastic. I'll tell you, we booked in last year 20,000 people through our system, 20,000 people, which is pretty remarkable when you think about all the work that goes into that. They provide care to all of the people in our custody 24 hours, 7 days a week. So they're very attuned to when folks have needs such as glasses or other things, and we'll jump right on making sure that they're providing with the things that they need while they're in custody.
Thank you. Welcome to community member Matt McElroy. If you want to introduce yourself and share your comments, the floor is yours.
Good afternoon, good evening, sorry. Getting my notes ready here. I was unmuting there. Good evening, members of the Citizen Oversight Board and Sheriff Diggins. I've filed complaints with the Denver Sheriff's Department, the Denver Police Department, and the Denver Fire Department in regards to my detention in September 2021. Over the last year, I've made numerous attempts to resolve my complaints with each agency, the Citizen Oversight Board, the Office of the Independent Monitor, as well. These attempts have all been passively investigated, and I've been shown no true dedication to resolving my claims. A few of my major concerns include, but are not limited to, the theft of my personal possessions by Denver Police Department, the assignment of a Denver Police Department officer who has previously been found to be corrupt and racially motivated traffic stops resulting in fines paid out by the city, the refusal of Denver Fire Department to investigate an off-duty officer who misrepresented himself as an on-duty while wearing an official Denver Fire Department uniform, and being detained by Denver Sheriff's Department for nearly 3 days without a single phone call, a single shower, any of my prescription medicine, or even being allowed out of my cell. I've reached out to the Citizen Oversight Board and have been put off because they feel my concerns are not as urgent as others. The number of claims of misconduct the Citizen Oversight Board is investigating is clear evidence of the continued corruption of the aforementioned agencies. At this point, I have no faith in any of these agencies. Therefore, I've been working with the United States Department of Justice in coordination with the offices of U.S. Senator John Hickenlooper and U.S. House Representative Joe Nagise, and they have issued congressional inquiries into my complaints with the U.S. Department of Justice. In addition to my complaints with the U.S. Department of Justice, I've begun the process of filing a civil lawsuit against all the aforementioned agencies. It is very clear the city and county of Denver has a serious and historical issue with corruption. Thank you for your time.
Thank you for your feedback and comments. Board member questions of our guest.
Is the proper pronunciation McElroy, Mr. McElroy?
Yes, sir.
Thank you. This is Commissioner Gardner. I have a quick question. Do you have dates on when you reached out to the COB in terms of, was it recently in terms of this year? Or?
Yeah, so originally, at the advice of legal counsel, I was encouraged not to report these claims as it may continue to cause further complications with my case. That attorney was released from my case by the court, and after he no-showed, and the court released him. I was then appointed a public defender who immediately told me to file my complaints. At that point, I've been in constant communication with the Office of the Independent Monitor, with the sheriff himself, most recently waiting 2 weeks, these last 2 weeks, for any response from Sheriff Diggins. I received no response from him. I also received no response from the investigator. I received a letter dated August 12th, or around that time, stating that my claims have been dismissed and there is no finding. I do understand the fact that they are reported at a later date. However, that was the legal advice given by my attorney.
Thank you.
Other board member questions? Okay, sir. Thank you so much for your sharing your experience with us, and something that has been very hard and was a trying experience. And we certainly understand that not having immediate resolution to that is so frustrating. And so really appreciate you coming to the COB to share that, and appreciate that you're now in a legal process around this. So with that, I think there is maybe one, or Sheriff, is there anything you'd like to say in response?
To Mr. McElroy? I received an email that I was CC'd in from Mr. McElroy, but that did not come to me. But again, certainly I'm sympathetic to anything that he has gone through, but believe those other bodies are more appropriate to look into the questions and complaints that he has.
Thank you. Again, encourage the community to provide any questions that they have. And I do see one in the Q&A, Sheriff, so perhaps we'll transition to that. We received a question that says, are there any concerns regarding overtime fatigue from your staff? And, perhaps a broader question is, what's the impact of, sort of continuous and lengthy overtime for your teammates?
There are concerns with overtime fatigue, which is why we're trying to spread out the amount of overtime that's worked in our agencies by bringing those provisional assignment staff members in to provide some relief to the deputies that are working on the floor. Those other measures that we talked about, the proactive recruitment, the lateral academies, opening the door to folks that have left our agency recently is something that we're also preparing to do. So all of the proactive steps that we're taking to address those strategies will begin to decrease the amount of overtime that all deputies are required to work.
Okay, I am not seeing any additional community member questions. Daniel, any that have come in through email? Okay. And really appreciate the time today, Sheriff, and thank you, community members, for sharing your points of view with us. We look forward to that every meeting. And as a reminder, public comment is always a part of our meeting should anyone wish to share an experience or a concern with the COB. So not just quarterly public forums, but we meet the first and third Fridays of every month, and are eager to receive community concerns, as that's part of our purpose and charter. So bring them on. And with that, I will close out the forum tonight and thank everyone for your attendance.
All right, thank you, everyone. Have a good night.
Good night.
Thank you. Good night.